Thank you to all of you for joining us for Reaching the Last Mile, supporting the most vulnerable session, one of the many youth-led conversations taking place this week as part of IOF's Our Future, Our Voices virtual summit. Thank you for joining. I am particularly pleased to introduce two exceptional leaders that we have had the privilege at the International Youth Foundation to work with for many years. Gitanjali Babbar from India and Luke Rogers from the United Kingdom. So thank you for joining for this session and to share your thoughts with the participants of the summit. One of the reasons we wanted to do this session was to really look at what are some of the challenges the vulnerable communities face around the world. How could development go and achieve the last mile that we generally miss? And Gitanjali has been working to really uplift the lives of women and children who live in brothels in in India. And Luke has been an ardent champion through his own work for many years to advocate on behalf of young people who are in the foster care. So both beneficiaries who are forgotten, not well cared for sometimes, and maybe ignored. So thank you again, and I look forward to a very exciting conversations today. So my first question to both of you is, how are your beneficiaries, be it the youth in the foster care system or the women and the children who are living in the brothels, are perceived in your communities? And how has that posed a challenge for your own work in trying to really shift the mindset of people to view them differently? Luke, do you want to go first?
Okay, yeah, I can go first. To kind of unpack the question, I think the stigma for children in foster care in the UK, they're just seen negatively, usually seen as bad kids. And I think that if you're only exposed to a media representation of these young people, that's all you think. That poses significant challenges in society for them, especially when it comes to leaving care. Because they're going into work, they're trying to find employment opportunities, and if they've come from a care experience and people are aware of that, they can perceive them as bad kids. Again, as a big societal thing, if that turns into a self-fulfilling prophecy. Like if we believe kids to be bad, they start to inhabit that belief in themselves because we project it towards them. We see it in schools, in kind of cultures which you can't see. In schools as well, we'll kind of treat these kids differently. We'll expect them not to achieve amongst their peers, and statistics also kind of support that notion that children in care do achieve less. So, in terms of the stigma element, is there's evidence both through statistics that these kids achieve less. There's a stigma that they're naughty and bad kids, which that combined with the statistics creates a kind of mindset towards these children that they're no hope, they can't be helped, they won't be helped, and they don't achieve anyway. So the morale of people and the way people communicate towards those groups, they won't support them as much as they would support their peers. So I think that's a huge challenge from a stigma point of view.
Great, thank you, Luke. And Gitanjali, in your case.
In our case, if you ask me that how the women who are forced into sex work are treated in India, I would say they're treated as sinners. They're treated as blind spots of the society. They carry a taboo with themselves all the time. The people, whenever even, it's a big problem for the people who wants to work with these women and children, because the society will definitely look down upon you as well. That, oh, you're going to a brothel, you're going to work in a brothel. And brothel is not considered as a good space. And these women and the children of these women are definitely, the day they are born to a sex worker, they're only known as a child of a sex worker, and no other identity is given to that child. So that child actually lives in that fear throughout his or her life, that I'm nobody else but just a child of a sex worker. And because in India, people doesn't want to talk about sex work much. They don't even want to talk about sex much. And they don't even want to know the reality that how these women have reached these brothels. The only thing they know is that, oh, that area is not good. That area is not for respectable people to go. and these women should not be a part of the community at all.
Great. Thank you, Gitanjali. So, the words that jump out to me: bad kids, sinners, no identity. And it's a pretty tough mindsets that you are working to change. And so if you could share with the audience just some of the work you have done through your own organization in really uplifting the voices of these forgotten communities, and really uplift their lives longer term. So Gitanjali, do you want to start sharing some of the work that your organization has done?
Yeah, so Katkatha has been working in the red light area from past 8 years now. And our work is both inside the red light area and outside the red light area. Inside the red light area, because these women, they only don't accept themselves. They also feel that, yes, in this lifetime, they have to do this job so that in the next lifetime, they can become like any of us. They can live a respectable life. So they continue be a part of this whole vicious circle. So what we are doing is that we are working with the women. We are working, we are building relationship with the women. The whole idea is to help them see their own soul, help them see their own beauty, and also explore the possibilities which they carry in themselves through education, through skill building, through different exposure, through therapies. So that's what we have been targeting from past 8 years, and that's what it's our motto, that every woman on that road should meet her own self. And should believe in her own self. And similarly, with the outside world, through our social media and through a lot of seminars and a lot of talk, we are actually talking about this issue now. Now the time has come. In the past 2 years, I've seen people want to know about this issue. Whenever a new government official comes in our area, they literally call us down that, okay, what is the status of these women? But earlier, nobody wanted to talk about it. Even today, if you reach out to any political party, they don't want to first consider, they even recognize that these women exist. So this is our work, to slowly reach out to each individual in the larger society with the message that this woman could be any woman. She could be from your own family, and they need us. That's how Katkatha has been working with this mission, that one day we will look everybody with the equal eyes.
Yes. Thank you, Gitanjali. For me, I think even if when I see in development sector a lot talk about your project, they would immediately go into these are the things we have done. But I think to take a step back, what you're saying is so powerful that first you need to really change, particularly if you're working with vulnerable communities who are perceived in a certain way. It's first important to change the mindset of the people, of how they view them, as starting to view them as full humans that deserve attention, care, and possibilities to be hopeful, for them to be hopeful about their lives. So thank you for sharing that. Now, Luke, you come from foster care system yourself, and talk to us a bit about what motivated you to get in this field, and what have you been doing in all these years to advocate for foster care kids in the UK?
Yeah, I kind of made it up as I went along, I think, at the start. So, I was brought up in the foster care system, and I was one of these kids that was defined as a naughty kid and wasn't given opportunities, wasn't given a platform to I just wasn't given opportunities. I think people didn't assume that I would be able to achieve. And I also didn't believe myself. And it was by chance I was given an opportunity to speak to kids about health and fitness. I was a personal trainer at the time. And the kids, a lot of them couldn't speak English. They were really young kids. They weren't really interested in coming and having a talk about health and fitness. And the event itself, there was candy everywhere. So I was like, well, what is the point in this event? Why am I here? And I was quite cynical at the time. And I was told by the organizer that it's known as youth participation. And that all local government have a statutory obligation to involve those that have experienced care, who have got lived experience, into the services that provide the care. And what I realized at that moment was this was really tokenistic. We'd brought someone that had experienced care to talk about health and fitness, which health is a priority for the government for young people. And that to come from someone that's experienced care talking to those kids should be beneficial, but it really wasn't. So the kids didn't listen, the foster carers did. And I thought at that moment, and I kind of realized at the time that sharing a story was powerful. I'd never shared my story before. I didn't think it had any worth. like lots of kids that leave care, they think that their story holds them back. There's a lot of similarities in what we've just heard in terms of the way people think about themselves. I think it's a human condition to kind of think negatively about yourself when you come from some form of background that may be difficult, and you must learn to love yourself first and foremost. I think sharing the story to the foster carers, I could see the impact in two ways. One, the impact on me, because it was quite lethargic and therapeutic to kind of go, this is what I'd experienced, and these were the people that made a difference in my life. And although in that moment, at that time, I did not listen, and I would have pushed people away, later in life, I recall those moments, and they give me some form of empowerment moving forward. But secondly, for the foster carers, which was the most powerful thing, is that it reminded them why they did their job. I think working with children is really difficult. It comes with significant challenge. A lot of the time, children are pushing you away because what you represent is a relationship that they fear, because before that relationship has gone and hurt them. And kids can push and shove. So I think reminding people why the impact that they can have through the positive relationships they have with children, helping children discover who they are, it really reminds people why they do what they do, and it's a motivating factor for them to continue it. And just recognizing that you have genuine impact with people if you spend time, if you build relationships, and if you really care. That's the concept of what we do, essentially.
Great. Now, Luke, Gitanjali, you can start with this question. When you look back, and you've been doing this for almost a decade now, when you look back, what are top 2 or 3 accomplishments you're so proud of when through your work? Can you think of a few and share with us? It may be a moment, it may be a statistic, it may be a feeling that you heard from one of your beneficiaries. What jumps out to you?
So there is a story, if I can share that.
Sure.
So like 8 years back, even today, I was in that brothel. And 8 years back, when I went to that brothel, the owner of that brothel, she actually, held me from my collar, and she asked me to just get out. And she literally pushed me from the stairs. And that time I told her that, please trust me, and I'm not here to do any rescue operation. And then that time I asked her to give her one of the child in the brothel to us, so that the child can get education and he can become a successful person in the world. And she was like that, no, nothing can happen to our children, just go away. But slowly that child started coming to our center. And 2 years back, there was a competition going on, and a dance competition. And he's a very bright student. He recently passed his 12th grade with beautiful marks. And that woman that time told me that if this child will study or will be able to do anything, I will change my name. So that's how she was like, you will not be able to do any change with the children of sex workers. And if he can change, then I will change my name. So 2 years back, we were sitting in an auditorium, and this boy was performing on the stage, and he got a trophy of best dancer. So I went to this owner and I told her, and she came to watch the show. And I went to this owner and told her that, okay, now what name should I give you? I mean, what new name would you like me to give you? And she looked at me and she said, you did it. So I said, yeah, because, there was no option. And this is not just one child. This is about everybody. When I started this journey, every person in my life, my family, my friends, everybody just told me one thing, that you're a young girl and you will not be able to sustain on that road for more than few months, or maybe 1 or 2 years. And when I meet those people, and when they come to in fact, the carnival which we developed in Brazil, when that carnival happens every year on that road, and thousands of people are coming for that carnival now, it just gives me that feeling that if you are committed, then everything is possible. And I'm really proud of that.
Thank you, Gitanjali. And what you shared just now is not on a reporting format of donors sometimes, right? They look at numbers. And I think what you're talking about, the trust that you have built with the community that you're serving. And it is so important when you think about development work. So thank you for sharing that story. Luke, what jumps out to you?
Yeah, and a number of things. I think one of the things around kind of within organizations is every single children's service talks about being people facing. So they're always saying we need to engage and involve young people in service delivery and improvement. But when you look at it, the bureaucratic systems in place don't support it. And that's a really fascinating concept because we communicate that's what we want to do, but we don't have the system in place to actually do it. So you kind of create this void and this gap. One of our latest programs was with the third sector and with a charity, and we started off by being asked, we just want you to get a group of young people together who can be the steering group for this charity, which is a really common ask. And when you always start with these groups of young people, they always start with this level of cynicism, which is kind of like, nobody will listen, nobody cares, and it's kind of pointless. And I think what we try and create within that space and successfully create is what we call a bridge in communication. So it's been able to get young people to present themselves to these boards in particular ways to actually inform change while keeping the essence of who they are. I think within our sector, there's a danger of professionalizing young people or keeping young people in a space where they're just young people and not listening to them. There's this space about it being smack bang in the middle where you can translate their stories into strategies. So because it's statutory, the government in 2016, they released £100 million for projects to apply for funding for, and said these have to be involved, they have to involve young people, but nobody involved them in the first round of funding. And we supported the government throughout the first year to kind of say that these projects are becoming successful, but we're not setting up a bureaucratic system that actually puts young people into a governance model that actually enables them to inform change. We're just having groups of young people who communicate, who go to the board and say, we have an idea, and the board go, that's really nice, thank you very much. There was no kind of governance structure, no oversight or accountability. So we did some work with the government, and in the second year, they released £200 million. And they made it statutory that every single organisation had to include a youth group and young people within that governance structure and that model. So they have to actually do it. The success of that particular piece of work, because we supported so many of them, has led us to gain some funding. So that now we're going to be training, starting next year, it was meant to start April this year, something called the Care Leaders Fellowship, which is teaching 20 care leavers skills in social enterprise, leadership and youth engagement, so they can develop and design their own projects now, rather than informing projects that have been developed for them. It's actually giving them the actual skills that they require to set up their own project themselves, rather than informing ones that have been set up for them, which is amazing. So yeah,
that's wonderful. And just on a scale of working with the government and unlocking, such a major investment to engage young people. And you are so correct. One of the challenges that I've also seen is a lot of times when people think about the next generations in engagement in really designing and being the architect of their own lives, what people tend to forget is that you need to meet them where they're at. You need to meet them in their culture. You need to meet them where they're already gathering or in their own, how they think. There's a tendency to make them more professional, let them make better. Can they have a tie and sit on the same room with other folks sitting on the tie? Maybe young people want to sit on the floor. So do that, change that. And so thank you for sharing that, Luke, as well. Now, this is being watched by this conversation is being watched by funders, corporations, government agencies, young people, many others. If I were to ask both of you, what are some recommendations you want to give to them as somebody who have done this work as a young person for more than a decade in reaching to vulnerable communities? What are some really practical recommendations you want to give to them?
I would say, and I would only request people to actually respect subtlety over scale. And also really go with the pace of community. The pace of such communities are not like, you can't see impact in 1 or 2 years. You really need to have perseverance. You really need to stay there. And the trust, and if you ask me, frankly, donors want impact like in 3 years. They want to see 500 children out of sex work in 2 years. They want to see 500 women out of sex work in like fraction of like 1 or 2 years. So my only request is that such work requires a lot of time. And if we are willing to give our life to this cause, then we would request people to actually believe and to actually, give that time, have that patience.
Yeah, thank you.
And also I would just have one more thing, that a lot of times donors just wants to give you donations for assets, for infrastructure, and not for people. And not every work can be done through tabs or through laptops or through assets. For such communities, you need people who can go there inside the brothels and talk to these people. So my second request is to really build a community which is empathetic and compassionate towards such society, and they're willing to go into these societies and bring a change. So invest in such people, because in my team also, I look at people, they really need therapy. They really need all those mindfulness activities to keep their motivation, to keep their inspiration up all the time. And that support is what I think the donors can support us to build that kind of a ecosystem for the people who are working for last mile communities.
Mm-hmm. Thank you, Gitanjali. The worst that really jumped out to me was that change doesn't happen in a year. Invest in people. It has a longer term sustainability, the impact itself. I wanted to add one more question to that is, what would you suggest somebody who wants to scale the impact, who wants to, do it in big numbers? What is your answer to them?
That is possible. Like now, after 8 years, I could say that, yes, we can do the scale. But the first few years of building that relationship, going into that community, meeting them there, that requires time.
Yes.
Not every change is possible in scale, and not every change should be calculated in terms of scale.
Yes. Thank you, Gitanjali. And Luke, what?
Yeah. Cool. I think with my particular sector, they're seen as one group of individuals. So if you was to see it as when you come into care to when you leave care, that's a journey. So I'm going to focus on kind of like the teenagers that leave care, because that's the biggest area that has the biggest challenge. So yeah, the most practical thing that you can give people isn't finance. If someone's got an idea, so this is on the essence of like working with social enterprises, people have ideas to make a difference informed by their experiences. The biggest support that you can give them is coaching, is therapy, is first to kind of self-develop, to understand who you are. That is by far the most important thing. I think what organizations will tend to do is give people money and say, we like your idea, please go and do it. But they don't have the capacity or skill yet to actually facilitate programs. So instead of seeing them as one group, we see them as a group of three. So first of all, you've got individuals that have had a personal experience but want to make a difference that don't know how. They're kind of like your unsung leaders, your unknown leaders. They need a lot of coaching, a lot of therapy, a lot of support to help nurture an idea. The second group of people that tend to exist are people that can name one area of impact that they have. Bearing in mind that being in care is from birth to leaving care. There's journeys along that. There's different types of care, like foster care, residential care. There's leaving care. There's working with kids in schools. Like the second group of people can name one area that they want to have an impact in. Now they've usually done some form of work before, so they need a combination of both coaching, but also particular coaching in particular areas. So it might be like project management, leadership, public speaking, training, whatever they're interested in, and some funding. And then there's a third group of people that are successful in working in multiple areas that need funding and also growth support. And can succeed and excel very independently. The problem with our world and when it comes to investment is we categorize people in kind of one area and as a whole a group of care leavers. So the funding and the support is extremely limited for people that would want to grow, and it's also not very helpful for those that have no idea of where they're going to go. The funding kind of sits in this kind of middle space where it just gives very little incremental bits of funding and support to young people to do smaller projects.
Mm-hmm.
So it's really hard to kind of jump out of that space. And the real issue is around it is that the majority of time, because of how we see young people, is that participation isn't done very well because it's usually done individually in silos. We don't connect people together and discuss and create ideas collectively, which is what we're doing with the fellowship. It's bringing people together to share ideas. So they don't invest in that particular area of youth engagement because it's not done well, like stereotypically. So it's that catch-22. It's like, well, we don't invest because it's not done well. But when we do invest, it's still not done well. It's because there's this kind of element of coaching and support that doesn't exist. We kind of expect young people to be which you said to be professionals, and we always have a phrase for that. When young people are praised for being professional, we ask the directors to come to one of our meetings, and we'll judge them on how childlike they can be. Because it's got to go both ways. So,
Yes.
and it's really, so yeah, a lot more recognition of helping people discover who they are and nurture people. The funding and finance is actually secondary. First, it's really kind of giving people a space to explore and to learn and to grow in a nurturing space.
Yes, thank you, Luke. And what you said about needing to not put the whole population in one silo, but looking at really at stages of growth. What stage are they in? And then making sure that the intervention is targeted towards that particular stage and where they're at for folks to do that. Well, thank you. I know we are reaching to the end of our conversation, but I did want to ask you one question. We're in the midst of a global pandemic. We are also in the midst of a global community that has developed a Sustainable Development Goals 2030 with, not wanting to leave anybody behind. And you are working in your own communities in India and UK to uplift the voices of the most vulnerable communities. Let's say you open up a newspaper in 2030 and you want to see a headline, which is going to reflect how your beneficiaries have been impacted or how the narrative has changed because of the work you have done in your community. What would that headline say, or what would you want it to say?
Yeah, well, I think for us, it's around lived experience leadership being recognized. So there is leadership that has come from personal lived experience that is currently hidden in the world. And there is a huge movement to kind of get lived experience leadership kind of out there. And for me, the world in the future is seeing that in its own right as a category or as an area where individuals can be respected, have a platform, it be completely, I suppose, that common that it's invisible. I think that's when you know you've succeeded, is that lived experience leadership informed by experiences becomes invisible because it's so common, not because we're trying to hide it.
Great, thank you, Luke. And Gitanjali, for you?
I think for me, the headline would say that no new women or child is forced into sex work. And the women of our country are they are in charge of their own lives, emotionally, physically, and financially. I think that I would really like to see in 2020, that there is no forced sex work.
Great, thank you, Gitanjali. And you both have, through your work in almost a decade, have galvanized, catalyzed young people to really create change. I know, Gitanjali, you have worked in getting university students and go and work in the brothels to ensure that they have the people living, they have the voices. Luke, you have done the same, and I commend your work that you have done, and really, in a way, setting the stage of what the next generation could do as well, and learn from you all. And few words that resonate with me in our conversation today is the self-worth that you talked about. You talked about compassion. You talked about community, investment in community, in people, lived experience. And when I look back of those words, those are words that are sometimes very hard to measure as well. And so my call, as we think through, and I think it's a collective call as well, is that not sometimes every transformational change can be measured, right? So we need to really look at the feeling part. We need to look at how you are building that trust with the community, how they are feeling versus just doing. It needs also to be a narrative of what development should mean and look like. So I appreciate it. I commend your work, and thank you to both Luke and Gitanjali for sharing their insights and experience in this session. And we at the International Youth Foundation hope this conversation has inspired many of you, and we look forward to having you in many more conversations this week during our Global Virtual Summit. So thank you all.
Thank you.
Thank you very much.